Hello, welcome to our presentation on iron supplements.
Psychological effects of iron supplement. Iron is required to transport red blood cells throughout the body. It is also a great supporter in making molecules that are necessary in the making of brain chemicals that are effective to our mental health. Iron is necessary to make serotonin, dopamine, norepinephrine. Lack of iron can lead to worsening symptoms for mental health illnesses such as depression, anxiety, and schizophrenia. Studies have shown and proven connections between low iron, anemia, and mental disorders. Iron supplements have proven to improve symptoms of these mental illnesses.
There are different types of iron supplements, and each has a different chemical makeup and strength, and what determines the strength is the elemental iron amount. The three main types of iron for iron supplementation that are generally used include ferrous sulfate, ferrous fumarate, and ferrous gluconate. So ferrous sulfate contains 20% of elemental iron, which is lower than ferrous fumarate, but higher than ferrous gluconate. It is also the most common of the ferrous salts used for iron supplementation. And if you look to the left over at this chemical structure, you can see this little ferrous ion, which is in all of the ferrous salt structures. Ferrous fumarate, it contains 33% of elemental iron, which is the highest amount out of all the ferrous salts. This one is also not used as frequently, even though it has a higher amount of elemental iron, because it increases the adverse side effects because of the amount of iron. Ferrous gluconate, it contains 12% of elemental iron, which is the lowest out of all the ferrous salts, and it's usually used for liquid supplementation rather than a tablet form. When someone takes an iron supplement, it is first absorbed through the stomach and the small intestine. It is then transported across the cell membrane via the divalent metal transporter 1. It is then converted into ferritin and stored in the macrophage, which is then converted to a ferrous ion, and it is then transferred to other sites of the body for red blood cell synthesis and hemoglobin creation. And this is also how we get oxygen throughout our body. Iron supplements are generally used to treat anemia and to increase iron for those who are not anemic but still have low iron levels. Anemia is caused by low hemoglobin concentration in the blood, and anemia affects 1.2 billion people around the world, which is why it's important for us to have iron supplements, and especially have iron supplements that are effective. Overall, oral iron supplementation has been shown to increase iron levels in those who are anemic. However, iron efficacy has been shown to be affected by increased hepcidin expression. And what this means is when you take an iron supplement, your body increases hepcidin levels, and this makes it so you don't absorb extra iron, so you don't have iron overload. So when you keep taking iron supplements, it's not as effective when these hepcidin levels are higher. Oral iron supplements may also be ineffective because people choose to not take them or to stop taking them because of the gastrointestinal adverse effects, which are very common for iron supplements. Researchers are trying to find better ways to supplement iron due to the GI side effects and the issues with absorption. And some of these ways that they are currently researching include liquid formulation, which the ideal dosing is unknown because there hasn't been much research into it. And the efficacy compared to ferrous salts is pretty unknown too. It might even be comparable from some of the research currently done. For polysaccharide iron complex, it has the same GI toxicity effects and less efficacy compared to ferrous salts. So the current tablets we have right now would be better because of that efficacy. For carbonyl iron, there currently hasn't been any significant data to suggest it's any better than ferrous salts, but there still does need to be more research done. Iron protein succinylate needs more research to be done, but current research has shown that it has a better side effect profile compared to ferrous salts, which would be very good because that would encourage people to keep taking their iron supplements as they wouldn't be having so many adverse side effects. The iron hydroxide adipate tartrate is currently in later phase clinical trials, and it's suggested to have a higher efficacy and less GI toxicity compared to ferrous salts, and is currently available in Europe for distribution. And then sucrosomial iron has increased bioavailability, which means it's absorbed better, and it has shown increased GI tolerance in people. It's currently available in 60 countries and is recommended by some as a first-line iron supplement.
Hi, my name is Diamond Bottoson. I'm going to be talking to you about supplemental iron dosage, iron supplement dosage, and then adverse effects and benefits, etc., based off of pharmacists that I spoke to about this. According to the pharmacist, the recommended dosage for adult consumers that have iron deficiency is 65 milligrams of elemental iron, which is in a 325 milligram tablet that someone should take every other day. For consumers without iron deficiency, the recommended daily dosage is based on the age of the consumer, or they are pregnant or a lactating female. For example, a female that is pregnant should have 27 milligrams of elemental iron. A baby that is 0 to 6 months should have 0.27 milligrams of elemental iron. A kid that is 4 to 8 years old should have 10 milligrams of elemental iron. Males that are 14 to 18 years old should have 11 milligrams of elemental iron. And then males that are 19 to 50 should have 8 milligrams of elemental iron. Okay, so now I'll be talking to you about adverse effects and benefits, etc. that I'll talk to a pharmacist about. Again, I am Diamond Bottoson. So some of these adverse effects of taking the Ironman supplement include constipation, diarrhea, stomach pain, which upset stomach, throwing up, and sometimes you can have a decreased appetite. Changing your stool color to green, so from brownish to green. And if you're taking the iron supplement in the liquid form, this could stain the mouth, because this could stain your mouth, your teeth, or any feelings you have. If taken with food, it could cause upset stomach. So it's recommended that you take it on an empty stomach before breakfast or in between meals for best results. There's also the possibility that someone could be allergic to iron supplements. So that's also something to discuss and figure out with a doctor. And then the benefits are iron supplements give you energy, and it helps improve your iron levels if you are iron deficient.
Our group's recommendation for iron supplement. With reflection of benefits and adverse effects of iron supplements, we recommend that one who is struggling with anemia, lower iron levels, or mental illnesses should consider taking iron supplements. Before taking the supplement, one should always converse with their medical personnel. There is risk of acquiring too much iron. This can have many poor side effects and could damage your body greatly.